All right, let's talk about the quadriceps and back pain. Um, there's a number of reasons for back pain, but there's only really certain patterns that show up over and over. One of which is with an anterior tipped pelvis. Um, there's a few muscles, so as iliacus, tensor fasciae lata, part of the anterior fibers of the gluteus medius and minimus. All of those can assist with and even create anterior anterior flexion to the pelvis. But the quadriceps, most of which attach on the femur and aren't really hip flexors, the rectus femoris comes all the way up and attaches on the ilium at the AIIS. So the quadricep muscle follows the path of my hand, crosses the hip joint, and attaches on the pelvis. So when that's tight, it pulls the pelvis forward into flexion. When that happens, the spine's angling off at an extreme degree, and so the muscles in the back of the spine work really, really hard to rectify that spine and bring it back upright to vertical. And so the back gets compressed, the muscles get hypertrophic, they get hypercontracted, they get tight, and you feel it in the back. The space for the nerves to exit the spine gets compressed. Those holes there, the discs get compressed. All of that is actually a response to the anterior tipped pelvis when that's present. And so this was part of my story for years. My quads were overdeveloped, I guess that'd be fair to say, because of just certain aspects of training and training habits. I would work the hell out of the quads, and then I would stretch the hamstrings and stretch the adductors and stretch just about everything else and not stretch the quads, and then I'd go work the hell out of the quads again. So what that was doing was teaching the quadriceps to contract, and not teaching them to release. So whatever we do, we have to remember to undo the doing. If I'm teaching the quads to contract, that's going to pull the pelvis into a flexion. So then I need to stretch the quads. And really, it's not even about flexibility. It's about getting them to let go to reset the baseline tonus when you're standing. But that's beside the point. What we want is for the pelvis to be able to come back to level. When the pelvis comes back to level, all of these issues get a ton better. So I spent years and years and years trying to gain flexibility in my back, to try to mobilize my back, to gain increased control over each vertebrae and each vertebral section, all of which were really good, useful things, but they didn't solve the problem of most of what my back was doing was in response to the pelvis being tipped forward. And until I got rid of that, the back pain wasn't going to go very far. And I've seen this a lot with a lot of other clients over the years. Worked on a fellow, he was 80 years old, and he played football through high school and then in college, and then he became a football coach. So for several decades, he was a football coach at the high school. So on the one hand, he was getting way more exercise than most people, tons of benefits to doing that. He got to do something he loved, but he had the same problem that I did and a lot of folks had, which was he worked his quads like crazy, running upstairs, doing all the things to get the quads strong, and never stretched them. So he came in, he was 80 years old, and he had about a 30-degree tip to his pelvis. So then his back was just completely compressed, trying to, it's like a tree growing out sideways out of a rock, and then it'll rectify itself. This guy had back pain for close to 50 years. And we got rid of the anterior pelvic tilt by getting the quads to release. Boom. His quads let go. Now his pelvis could sit more level, and all this compression in the back just kind of magically disappears because it's there compensating for the pelvic tilt. So like I said, not trying to oversimplify back pain. There's several causes. There's a lot of causes, but most of them fit into a few patterns. And one of the patterns is with an anterior pelvic tilt, which can be caused from the quadriceps. It can also be caused by a number of other muscles, what we loosely call the hip flexors. So sometimes somebody has an anterior tilt and it's the quads. Sometimes it's the iliacus. Sometimes it's the psoas, sometimes it's the TFL. It can be a few things. However, quads are often overlooked both in training and physical training. They're often overlooked by a lot of therapists. And it's a very, very common pattern. We can talk about quad dominance, and there are ways in your training regime to help balance that out. But the truth of the matter is, most really good athletes are quad dominant. It's just part of the deal. And it's great to balance that out with glute strength and hip extension capabilities, but you got to undo the doing. So if I'm teaching the quads to contract all day, if I'm putting them through the ringer and making them contract, and then I don't teach them to release, they will keep pulling and pull the pelvis into an anterior tilt. So if I teach them to contract, I have to undo the doing and teach them to lengthen again, and then I can find neutral in my pelvis. All right.